Hello everyone, a warm welcome to the state level webinar organized by the Women's Cell of Dhempe College of Arts and Science. The topic of this webinar is Women's Health Challenges and Solutions. Well, we all know that women's lives have transformed over the centuries. It is no secret that women are leading busier lives than ever before and have a tendency to neglect their health. A woman plays a pivotal role in maintaining the health and overall well-being of a family. In fact, we can say that a woman is the fulcrum of the family as well as the community at large. Therefore, it is imperative that women take time to maintain good health for themselves as well. There are a number of health issues that are specific to women alone and which we need to be aware of so that they can actually be prevented. In order to throw light on such issues, we have invited two young and dynamic medical practitioners, Dr. Tanvi Pai Raiturkar and Dr. Rini Naik. Dr. Tanvi Pai Raiturkar is a practicing ophthalmologist. She has just started a new venture, Tanvi's Eye Care Clinic at Banjul. And Dr. Rini Naik is a gynecologist. Both these young medical practitioners have made a name for themselves in their own field. Our organizing secretary, Dr. K.K. Teresa, will be formally introducing both the speakers. So I won't be speaking much as of now. So before wasting your time, I would now like to request our principal, who in fact has initiated this webinar. And so now I request our principal, Professor Vrinda Bodkar, to kindly welcome the participants and our guest speakers.
Before I start, I would request Dr. Teresa to just mute her mic. Okay. Thank you, Teresa. Good evening and welcome to state level seminar on women's health challenges and solutions. And the apt resource persons have been invited by Women's Cell of our college, Dr. Rini Naik and Dr. Tanvi Raiturkar. It is my pleasure to welcome you both to Dhempe College seminar. I welcome also staff, students and other participants present online. The topic is suitable in present situation when India is trying to address all health related issues, and this is part of sustainable development goal with special focus on women and children. Just if we take one area, that is anemia, it is observed that 55% of women in India are anemic, and India tops the list of having women in anemic condition. Similarly, there are many other issues on which the focus should be, like hygiene, nutrition, and to address these issues, we have invited two doctors, Dr. Rini and Dr. Tanvi. I welcome all the participants and wish a fruitful deliberation. Thank you very much.
Thank you, ma'am. Good evening, everyone. So let us begin with today's first session. We have with us our first speaker for today's webinar, Dr. Tanvi Pai Raiturkar. Dr. Tanvi completed her MBBS from Goa Medical College in 2014. She is a university gold medalist during her MS in ophthalmology from Goa Medical College in 2017. Dr. Tanvi is trained in cataract and phacoemulsification from Center for Sight, Vadodara in 2017. She also completed fellowship in medical retina in 2018 at H.V. Desai Eye Hospital, Pune. Besides, she has completed DNB in Ophthalmology, Fellow of International Council of Ophthalmology, UK, membership of Royal Colleges of Surgeons, Edinburgh. Dr. Tanvi is having 23 research publications in national and international medical journals. Currently, Dr. Tanvi is working as a consultant in ophthalmology at Healthway Hospital, Old Goa, and Dr. Tanvi's Eye Care franchise. Dr. Tanvi, we will welcome you for this webinar. Over to you, Doctor.
Thank you, ma'am, for this warm welcome. I'm really honored to be part of this webinar, and thank you so much for giving me this opportunity. We will start our presentation soon. I hope I'm audible.
Yes, Dr. Tanvi, yes.
Yeah. So basically my topic for today is women and eye health. So before we go to the problems, particularly in women, we'll just have a short discussion about, what are the common eye problems which we face. So these are the topics I'm going to be covering up: common eye health issues, women's eye health, and eye as a window to general health and well-being. So the first topic, common eye diseases. So eye disorders can broadly be divided into these: refractive errors, infections and inflammations, age-related conditions, eye injuries, systemic diseases, and dry eye and computer vision syndrome. These are newer topics, so just put them as a sixth one, as the sixth classification. So we'll discuss all of these in detail. So going on to refractive errors. Now refractive errors, as we all know, most of us must be having some refractive error, at least a small one. So this is an error in sight which can be corrected by glasses, that is your spectacles, or contact lenses, or even the laser surgeries, or such as LASIK, which are available. So these include hypermetropia. Now hypermetropia is a long-sightedness or far-sightedness. Now here the individual is able to see what is at a distance, but is unable to see things which are close to him or her. Now this condition, in this condition, it is treated using convex lenses. Second one is myopia. Myopia is short-sightedness. In this condition, the individual is able to see objects nearer to him or her, but objects which are at a distance are not seen clearly. Third one is astigmatism. Now astigmatism is an error or a disturbance in the normal curvature of the eye. So there is something which goes wrong with the shape of the eye, and this gives rise to astigmatism. Now hypermetropia and myopia are corrected by spherical lenses, whereas astigmatism requires cylindrical correction. A cylinder is used to correct the sight. And the fourth one is pressed over 40 might have experienced it themselves. Things which are close to them. So reading the newspaper through the phone, mobile phone, or the computer becomes difficult. So these individuals need to hold the object. Further happens because the muscles in the eye, which help us in seeing near objects, these muscles are known as ciliary muscles. These become weak with age. So after 40 years of age, normally these muscles become weak and close to us. So this is why we require reading glasses after 40. So how do we detect, or what is our role? Now teachers, school teachers, or high secondary teachers, parents, they play a very important role in detection of these refractive errors. If any of the teacher is holding a book or the reading material very close to the eye, or there is half shutting of the eyes, there is frequent rubbing of the eyes, or the person complains of headache, eye strain, or a visible squint is noted, then we need to bring this to the notice, and probably the person has a refractive error. Okay, by squint I mean that the eyes are not aligned well. The eyes are not aligned straight. Okay, so the one eye is moved inward or outward. So this could be occurring as a result of, nowadays there are school eye health programs wherein the school themselves engage ophthalmologists who come to their school and screen the, or they arrange a meetup. I mean, they arrange the transfer of those students to the clinic. Okay, that's how refractive errors are not being missed up. Next one is infection and inflammation. Now, this I will show you by means of pictures. So these are the common eye infections, which now blepharitis of the lid margins or the eyelashes. Now in this picture, the first one you can see that there is yellowish discharge or crusts which are stuck to the lashes. Okay, so this occurs most commonly because of unhygienic conditions. So it's not like something which is safe for the eyes, like a small Johnson's baby shampoo bottle. A drop of it is taken on the palm of the hand with a little bit of water. It is used to scrub the lashes and then wash it off. A simple thing like this will take care of infections of the lashes. Okay. Second one is stye. Many of us might have got a stye in our life. In Konkani it is known as Anuli or Dongarpuri. So this is a condition wherein it's basically a skin infection. So here what happens is there is a painful swelling temperature. So it appears warm when you feel it. Okay, simple measure for one can bear, not very hot. Okay. Take a clean cloth, dip it in that, squeeze the excessive water. Simple measure like this can take care of a stye. Third one is conjunctivitis. I'm sure many of us might have had conjunctivitis also in the past. So conjunctivitis is a condition in which the eyes tend to be cellulitis. Nothing in conjunctivitis. Whereas in orbital cellulitis, all the layers of the eye, all the layers of the eye, right from the lids up to the nerves and the retina tend to get involved. Okay, so here you can see that the patient is unable to even open the eye completely and the eye is completely shut. Okay, now this is very dangerous because by way of the optic nerve, which is the nerve which supplies the eye, it can spread to the brain and can give rise to serious conditions such as meningitis or brain abscess and ultimately death. So what are the do's and don'ts? Firstly, visit an ophthalmologist. Do not try to the habit of going to the pharmacy and picking up some antibiotic drops and instilling. That is a no. Okay, because you don't know what the condition is, Now, in the last slide, I've shown you 4 different eye conditions. I'm sure many of us might have not even heard of such things, right? So, a small infection, what you think is just conjunctivitis, could actually be the start of something like an orbital cellulitis. So, do not try to self-treat. Secondly, practice good hand hygiene, frequent hand washing, which I'm sure everybody is doing now in view of the pandemic. Also, clean away any discharge from which to collect in the lashes or in the margins of the lids, because that is going to be a nidus of infection and the infection is going to just flare up. Secondly, then next thing is you're not supposed to share your towel or your hanky or your napkin with anybody else in the house, because you don't want the rest. When you have an infection, stop using the contact lenses. The cleaning solution, the contact lens cases should be disposed. Everything should be disposed and you have to ask for a new set. Also, any eye makeup that you have used before, during the infection has to be discarded, because of course the infection has gone into that makeup also. So something like an eyeliner or mascara. All those things which you have used have to be disposed of. Okay? If only then both your eyes are going to get injured. Also, once you have visited the doctor and antibiotics have been started, for the next 24 to 48 hours or till the infection or till the pink eye infection to anybody else, do not rub your eyes, and most importantly, do not pad the eye. Many a times we get a lot of relief, padding an eye with conjunctivitis, keeping the eye closed, is going to give you superb relief, but that is not what you should do, because then that the eye will act like an incubator. The temperature will rise and the infection is only going to flare up. Next, we move on to age-related conditions. Now, these include three main important ones: cataract, glaucoma, and age-related macular degeneration. So, in this picture, if you see the center of the eye, it is white, whereas in the previous one, let me go back to them, the center, that is the lens, it appears clear, right? Whereas in this one, it appears white. So, this is what cataract looks like. Okay, so the lens of the eye, the normal crystalline lens, which is supposed to be transparent, through light rays from outside, the lens becomes opaque or it becomes white, and the light rays are unable to penetrate the lens. That is when you get cataract. Now, cataract is an age-related thing. It happens usually after 50 or 60 years of age. But before that, also it can happen in individuals who have diabetes, who have had ocular infections in the past, who have had trauma. Okay, and many other conditions are there, but these are the main important ones. Okay, so the vision in cataract, which is supposed to look normally like the one here we see normal vision, it appears like this. It becomes cloudy or hazy. Many of us, whoever wears spectacles, might have sometimes experienced this fogging which happens when you're moving in a AC vehicle, and when you suddenly step out of the car and your glasses tend to get fogged. That is the type of vision you get in cataract. Second condition, age-related condition, is glaucoma. Now, glaucoma, we all know that there is something called the blood pressure, right? Blood has a blood pressure. So the blood pressure normally has to be in the range of what, 120 systolic and 80 diastolic, correct? And what happens is that blood pressure should not be more than that, which is a problem. Similarly, in the eye, we have something known as intraocular pressure, which is the pressure of the eye. Now that pressure also has a range. It should not be higher than that, it should not be lower than that. So glaucoma is a condition in which it tends to compress upon the nerve of the eye, which is the optic nerve. Okay, so any pressure on the optic nerve gives rise to a condition, it damages the optic nerve and gives rise to this condition which is known as glaucoma. Now this can also be an age-related issue. So normally when we are looking straight, this is the normal vision, right, on this side. So in the normal individual, if I'm looking straight, if I'm driving a car and I'm looking straight, I'm definitely able to see what's going on either sides of me, right? So I have a central vision as well as a peripheral vision, or what I can see in the sides. But in a patient with glaucoma, what happens is the peripheral vision tends to diminish. If I'm looking straight, I will be only able to see what is straight. I will not be able to see what is in the peripheral vision, keeps diminishing, and an individual is left with a central tunnel vision. That is what happens in glaucoma. Now the third condition is age-related macular. It is like it's like a curtain. It is the nervous layer of the eye. Okay, and that retina enables us to see, because the light rays penetrate into our cornea, into our. So the retina has to be healthy. Okay, and the retina itself is divided into further parts. There is a central part which is known as, helps us to see. It helps us to see the central vision. Okay, so in age-related macular degeneration, in this area, this very important area, which is called the macula, tends to develop degeneration. important to understand the serious, very serious. Now, in a state like Goa, MC casualty at night, you will realize that 90% of the accidents, many of, out of which majority of them would have would be overspeeding or would be under influence of alcohol. Now, most of these injuries, most commonly there is ocular injuries can range from a simple thing like a foreign body, like just a small particle which is there in the first image, to something great times that it has been impossible, to prevent any damage to the other eye, to the good eye. We have had to remove this eye completely. So it is that bad. So it's very important that we wear safety protective goggles while on the bike, or while doing any work during whatever our occupation. One of while playing. Wherever you can sustain eye injuries. Even simple things, like the ones which have in their eye. And you can imagine the pain when it pricks your eye. If you have it just touches your hand, how painful and bad it is. Right? So simple things. Redness of the eyes to something much more grave. Am I audible? Or
Doctor, your voice is breaking.
okay, is it okay now?
Yes. Yes.
Yeah. So basically now what happens in computer vision syndrome is when we are on the computer for a very long hour, for very long hours, okay, we tend to forget to blink. We are staring at the computer screen for a very long time, okay. So normally we blink about, it reduces to about 6 to 8 times per minute, which is very less, okay. As a result of this, what happens is your eyes tend to dry up, and you get things like symptoms like burning sensation, grittiness, and be worsened by environmental conditions such as smoking, post-cataract surgery, post-laser surgery, contact lens wear, even glare in the room, or having an air conditioner which is blowing air directly onto your face. So for this, it is important, and for all of you, it is very important that these online classes be a little short. First of all, secondly, if that is not possible, which is not possible in many cases because there's a lot of portion which needs to be covered up. So every 1 hour or every 1.5 hours, please look away from the computer screen and make sure that you blink your eyes forcefully or voluntarily. Okay, this is just so that your tear film is replenished and there is no dryness which occurs. Also, the way you sit on the chair is very important. Make sure that you have a good posture. Even now when I am sitting and talking to you, my posture is not right. But when you are working for long hours on the computer, you need to have a back rest, you need to have a foot rest. and the computer should be at least 10 to 20 degrees below your eye level. So let's go to the most important topic for the day, that is women. So now, why do we need to have a separate topic? What is different between the eye health in women and men? Okay, or why is women's eye health important at all? That is because 2/3 of the individuals living are women. Globally, there are 2.7 million women over the age of 40 who are blind. Also, there are certain eye conditions which I've already discussed. Things like cataract, glaucoma, age-related macular degeneration, dry eye, diabetic retinopathy, and thyroid eye disease. These are much more. Now, why are women at a greater risk? Fortunately, studies have shown that women live longer than men. Also, there are a lot of hormonal changes that take place. So now women live longer than men. So that means there will be more older women than older men, right? So age-related problems would be more common in women than in men, because there will be more women who are in the hormonal changes with age. Now in the life of a woman, there are multiple hormonal changes which take place. Pregnancy, at childbirth, and at menopause. So there are about 4 times that the hormone levels in the age of in the life of a woman, which keep the changes affect the rest of the body also. So according to similarly, they also affect the eyes. Okay, the third one is there are more chances of autoimmune diseases in women. Immunity, the system, right, fights infection, it takes care of the body. Okay, but sometimes what happens is this immune system tends to attack one's own body, and that is when you get autoimmune diseases. Now these autoimmune diseases are more common in women. Also, there are certain conditions which worsen in pregnancy. Conditions such as thyroid, conditions such as diabetes, they tend to worsen, or they tend to become more severe during pregnancy, and accordingly the changes seen because of them are also more common in pregnancy. Now, because of all these reasons, April is celebrated as Women's Eye Health and Safety Month. Now, how do we women ensure a good eye health? First of all, do not ignore your problems. Many a times it is very common. We might have seen it at home by our mothers, our grandmothers, or even ourselves. Many a times women tend to ignore their own health issues, and they feel that's not really important. They have other things to take care of, be it work, be it family or personal life. But a lot of times health is what is ignored by women, and that should not be the case. So regular eye checkup with a trained ophthalmologist is a must. So you need to also not just, and now by eye checkup I don't mean just like look for glasses whether there's a refractive error, okay, but a detailed examination including a fundus examination. A fundus examination is the examination of the retina. The retina also has to be checked, and this has to be done at regular intervals as told by your ophthalmologist. Also, you need to know your family's eye health history. Now, like other diseases like diabetes, hypertension, cholesterol, they have family history. So if your parents or if your grandparents or your siblings have had it, there are high chances that you will have it. Similarly is the eye health problems also. There are many eye disorders, or if your older generation or your siblings have had it. You need to know that, and you should tell your ophthalmologist, that so and so my family has been having this kind of an issue. So please evaluate me for that issue. Protective eyewear and sunglasses, I've told you, we've seen the trauma. Healthy, balanced eating habits, very important. Quit smoking. Smoking increases the health risk for other conditions, and other organ damage is more common if you're a smoker, as well as eye problems are much more common if you're a smoker. Conditions like age-related macular degeneration or occlusions of blood vessels in the retina are very common if you're a smoker. If you have any eye problem, best would be to avoid smoking, quit smoking. Get yourself evaluated for systemic illnesses also by a physician. So by systemic illnesses, I mean diabetes, blood pressure, cholesterol, all these have to be looked for. All women love eye makeup. There are some some like me who can't step out of the house without eye makeup, and I'm sure many of you all have the same problem. To bed, all the eye makeup should be removed from your eyes. Okay, use a good makeup remover and clean all that eye makeup. Okay, remember that your eye makeup can also get contaminated. If you had an eye infection, conjunctivitis or a stye, and if you use that makeup, please discard it. Also remember that it has an expiry also. No eye makeup is to be used beyond 6 months from the date of manufacture. Now, when to seek help from an ophthalmologist? When do you see your eye doctor? So, always remember that the eye at every point gives us some signs and symptoms, a little sensation, some redness here and there can be a sign of a bigger orbital cellulitis where all the layers of the eye get involved. Even a foreign body sensation, please get yourself evaluated, because it could be something that we are missing, or reduced vision, double vision, any redness of the eye, swelling of the eyelids or around the eye, any pain, definitely you have to go to an ophthalmologist, any discharge, any watering of the eye, flashes and floaters. By flashes, I mean whenever sometimes we are looking straight and you feel that there is some lightning or some sparks which are happening. Now these are signals it's coming from inside your eye. Have something grave like a retina onto your retina, and that is why floaters, I mean some black moving objects. Definitely you have to visit an ophthalmologist. And if you have been diagnosed of systemic diseases. So what does systemic diseases have to do with the eye? Now we need to, it's a very, I feel proud telling you that, the eye is the only organ in the human body where you can see the blood vessels, arteries, the veins can be seen directly without giving any cuts or incisions, without any surgery. You cut open, right? But okay. So eyes can tell us many things about our general systemic health. Many a times a person might not know he or she has diabetes or blood pressure, but the eye specialist or the ophthalmologist, when he or she has diabetes, and that is when the patient finds out. So diabetes, for example, can affect every part of the human body. Similarly, it can affect the eye and every part of the eye. There's a difference in it. Okay, a simple infected, and one can get a non-healing corneal ulcer. Early onset of cataract, I told you cataract was, but an early onset or a pre-senile cataract can be seen in diabetes. Glaucoma, more common in diabetes. Muscle imbalances and palsies. So sometimes we notice that one eye is not moving as much as the other. So when one eye is looking straight, the other is looking in some other direction. That could be because diabetes has affected your blood vessels and it has caused occlusions in the blood vessels which are supplying the muscles, and as a result the muscle has stopped moving. Retinopathy is a very important complication of diabetes. Now in diabetic retinopathy, they bleed and they may even cause detachment of the retina. Important that if you are a diabetic, you have to get evaluated for your retina. You have to get your occlusion of retinal blood vessels leading to lie, which takes information from the eye to the brain, and infection So diabetes in this picture you can see it can give rise to heart attacks, it can affect into paralysis. It can give of numbness and tingling sensation in the toes and in the fingers. It can affect to an individual having to undergo dialysis. Diabetic foot. By diabetic foot, I mean that patients who have small wounds on their feet can get infected and give rise to death of a limb, which is called gangrene, and ultimately the patient has to undergo amputation, where the limb has to be cut off. Then other conditions which lead to which are seen diabetic retinopathy. Now hypertension is high BP. When the BP is not the blood pressure is not maintained in normal range, it goes above the normal range, which is known as hypertension. Okay, this is also seen in the eye. If you undergo a retinal evaluation, you will the doctor will be able to tell you whether you have hypertension or not. Okay, blood vessels can give rise to muscle palsies and also can give rise to hypertension retinopathy. Now thyroid in women. Okay, women who are in the 20s to 40s commonly have thyroid, especially Indian women. So they need to undergo a thyroid evaluation as to eye problems. Now simple things like dry eye and burning sensation in the eye to complete loss of vision can occur in thyroid. Okay, that is known as thyroid eye disease. Get themselves evaluated by an ophthalmologist. Also should take looks like this. So thyroid eye disease with protruding eyes or exophthalmos. This is also very commonly seen in women who have hypercholesterolemia, that is the lipid profile is deranged. They have high cholesterol levels. There is deposition of these yellowish white plaques which are seen on the lids. Okay, this is known as xanthilase.
So when it matures, it ripens, it becomes a fruit. This is called sequence.
So the take home message from my session today is a window to you're suspecting. Please go and show your even after you have shown problems in women are more common than men, and do not ignore any problem and your health or concern. So please do not ignore your health because of other issues. Thank you so much. If there is anything you want to contact.
Papillinaceous glaucoma. I spend almost at least half an hour explaining what is papillinaceous glaucoma. This is look like papillinaceous.
Participants, please feel free to ask any questions to Dr. Tanvi. You can post your questions in the chat box or you can unmute and ask her. Please feel free.
Yes, ma'am, I had a question for Dr. Tanvi. Dr. Tanvi, what is the main reason for recurrent styes? Like, why do they keep coming again and again?
Yes. Now, the problem with recurrent stye could be, some, one thing I already told you, it could be that a person has diabetes. But if it is somebody else who's already had themselves evaluated for diabetes, then a very simple thing could be a refractive error. Now, what happens is when we are not able to see clearly, we keep touching our eyes and we rub our eyes. Okay, so basically stye is an infection of the skin. So when we keep rubbing an area, that area tends to get inflamed and infected. Also frequently touching your nose and touching your eyes, or using the same handkerchief for your nose and then wiping your eyes with it can give rise to such infection. So this has to be, diabetes is very important, but also these refractive errors and frequently scratching your eyes has to be avoided.
Thank you, doctor.
Anyone else? I'm sure most of us have realized that eye problems are more common in women. And as far as a woman's physiology is concerned, I think it is more prone to some particular issues which are pertinent and which should be taken care of. And as Dr. Tanvi says, we shouldn't be ignoring any eye problems because it can be a symptomatic condition towards something else which we are not aware of. So always prevention is always better than cure. Dr. Tanvi has addressed a lot of issues related to women, particularly related to the eye. How thyroid as well as pregnancy related issues can aggravate conditions. So participants, please ask questions if you have any. Anjali Rani, you have been leaving your camera on for quite some time. If you have any questions, you're free to ask. Otherwise, you can switch off your camera. You're causing a distraction to the others.
Thyroid is spotting.